There is a nationwide increase in the number of African American and Hispanic men committing suicide.
In North Texas, 6 counties have formed a mental health authority to try to address this issue, and that is the focus this week of Fox 4's Shaun Rabb's Here and Now conversation.
I am visiting with Dr. Walter Taylor. Dr. Taylor is the Chief Strategy Officer for NITBA, and that's the North Texas Behavioral Health Authority. And first, Dr. Taylor, tell us what that is.
It is a creation of the state and local county government. The county governments that came together to create NITBA and remain within NITBA are Dallas, Ellis, Hunt, Kaufman, Navarro, and Rockwall County. So those 6 counties have an agreement to create this administrative agency, which gets a contract from the state of Texas, Texas Health and Human Services Commission, to serve indigent individuals and families throughout the 6 counties for mental health and substance use services.
I'm looking at a recent report of that 6-county area, and there's some alarming numbers as it relates to suicides among people of color.
Absolutely, absolutely. The national data says that between 2019 and 2020, suicide as a whole among all categories except for brown and black males went down. For black and brown males, suicide increased, and we saw the same thing here in Dallas County. Among black males, Hispanic males, suicide is trending up and has been trending up for some time. We just, I think as a nation, as a county, as a community, looked at COVID-19, and then we started to look at what was COVID-19 doing, but also what did it reveal that was already taking place.
Have you been able, Dr. Taylor, to identify any possible reasons why?
Yes, suicide is very complex, and it's not just the one thing. Globally speaking, suicide is impacted by mental health, it's impacted by substance use, it's impacted by life events, loss of job, loss of spouse, terminal illness. When we really begin to deal with what may be causing that, in addition to these things for black and brown males, we have to look at what's going on in our society, what has gone on in our society in terms of the historical legacy of racism, the residue of racism, if you will, socioeconomic status, and things like that.
I guess first it's important to be able to try to identify someone who might be in crisis, even not in crisis, but their thinking has become dark.
Absolutely. We really promote mental health first aid. It teaches the average person, doesn't have to have a degree, doesn't have to have a clinical background. It's for lay people to be able to identify people who are in mental health distress and to help them to seek out the help that they need. We teach it. We have trained the trainer. We go out into the schools. We will train anybody in mental health first aid that wants to be trained, and it's free of charge. How
can folks, Dr. Taylor, get more information about the trainings that NITBA offers and other resources available through the North Texas Behavioral Healthcare Authority?
The quickest way really is to email me, brwtaylor@nitba.org. That's going to be the quickest way. We'll get you signed up. We have a series of trainings that we do called Courageous Conversations, where we're dealing with diversity, equity, and inclusion issues. Because as we know, in these historically oppressed, underserved areas, marginalized communities, there's always a challenge with access to care and also quality of care. And so this month, we're looking at counseling people within the BIPOC, Black, Indigenous, people of color, LGBTQIA+, and dealing with those issues so that we increasingly bring people into services and make them feel comfortable and welcome when they come into services.
All right, Dr. Taylor, thank you for the work that's being done at the North Texas Behavioral Healthcare Authority. Appreciate it, sir, very much.
Thank you, sir. God bless.
All right, for more information about the free programs available to you, email Dr. W. Taylor at ntbha.org. And the website is ntbha.org.